What is up, you guys? Dr. Elmer here with Pure Health Medical. Today we're going to go over some things that if you have kind of some neck tension associated with some headaches or tension in your head, forewarning, if you do have any sensitivity to light or sound, nausea, dizziness, you have an aura, anything like that associated with the headaches, or please seek out a medical provider to get assessed appropriately. But again, if this is just kind of general neck tension associated with some head tension, we have two areas that I want to show you that we can roll. The first is something that a lot of people have heard about, the suboccipitals. Right below the head here, these X's represent some knots that you can get. If you have these knots, it can refer pain and tension across the kind of the side of the head there. Then the other one is the upper trap, which a lot of people also know about. Again, that X would represent the knot, and this is what we call a ram horn pattern there. So the red is all possible areas that you can get pain, even to the corner of the jaw there, with just that knot. So we'll go over the first one here, the suboccipitals. Just gonna use our trusty lacrosse ball here. You can use a tennis ball to start out if you need. All you're gonna do is find a spot kind of at the base of the skull here that might be tender. It might take some time to kind of explore and find that for yourself. You can move your head side to side, rock back and forth. Then if you find a spot and just hang out there and kind of let the ball sink into that area, just try to relax your body and breathe through it until it kind of eases up a little bit. Then you can either find a different spot, or when you do find one, you can again just kind of rock your head up and down and side to side to kind of work out that tension. There's no set, really specific time that's better or worse. I usually just tell people about a minute or two if you're gonna do really any of these. If you want to do kind of the pin and stretch method, like I described earlier, about 10 or 15 reps on both sides. So then next one for that upper trap area, I'm gonna come to the wall. Okay, I'm gonna sandwich the lacrosse ball between my upper trap and the wall here, trying to find that knot kind of on the edge here. The first thing I'm gonna do is kind of quarter squat so that I can bend my knees, bend my hips, so that when I do sandwich the ball here, I can use my outside leg to push my body into the wall a little bit. And then again, you can find some, I got some knots in there. I need to take care of myself better. You can take your arm across your body. That will change the sensation and the intensity of it. Usually the more you go across, the more you'll feel it. The other way you can do this, it's actually, I can feel this going behind my eye on this right side here, so I need to work on this. But you can turn your head not only to the opposite side, but also down at the same time, and that will increase the stretch as well. So you can do that, arm across. Again, if you're gonna do this pin and stretch method, 10 to 15 reps, and then recheck neck range of motion and comfort. If you just wanna kind of roll around, let the ball sink in the area, I'll just spend about a minute or two on both sides doing that. So you guys, if you have any questions, comments, or just want to share any success stories with any of these, please feel free to share, and we look forward to hearing from you.